Welcome team to another session. Natasha, aged 20 years, a well-known anemic patient, admitted to your female medical ward presenting with headache, dizziness and tachycardia. As usual, remember our golden rule. Read the question and understand the stem of the question. What are the techniques? Know the name of your patient. Number 2, know the age of your patient. Number 3, know how is your patient presenting. Because we say money is on the presentation of the patient. Clear? Don't rush into answering section minus understanding the stem of the question. Be sharp. Clear? Done deal. Part A. Define anemia. Marks allocated 5%. In an exam, you are going to indicate A, small dash in front, and you are going to write anemia. Next, you are going to underline anemia. That's how you should be presenting work in an exam. Underline anemia. Below, give us the full definition. You can define like this. Anemia. This is a condition in which the body has a reduced level of hemoglobin in the blood. This is a condition in which the body has a reduced level of hemoglobin in the blood, affecting the circulatory system, specifically the red blood cells. Caused by blood loss. Clear? Characterized by fatigue, weakness, pale skin, dizziness, and also rapid heartbeat. That is the classical definition for anemia. And you can be awarded the full set of marks. Be sharp. Clear? Done deal. B1. State 5 signs and symptoms of anemia. Marks allocated 15%. What is the first word used by the examiner? State. What is the meaning of the word state? You list and give a brief statement to support your answer. And the best word to use is due to. Clear? Done deal. 1. Para. You underline para. Give us the due to, which is making sense. Due to reduced hemoglobin in the blood. Due to reduced hemoglobin in the blood. Next, fatigue and weakness. You underline. Due to reduced oxygen supply to the body tissues. Due to reduced oxygen supply to the body tissues. Next, dizziness. You underline. Due to reduced oxygen delivery to the brain. Due to reduced oxygen delivery to the brain. Done deal. Next, headache. You underline. Due to decreased oxygen supply to the brain tissues. Due to decreased oxygen supply to the brain tissues. Done deal. Next, chest pain. You underline chest pain. Due to insufficient oxygen reaching the heart muscles. Due to insufficient oxygen reaching the heart muscles. Remember, we have got a lot of clinical features for anemia. Research more, study more, until you become better than the next student you will be competing with during that exam. Be sharp. Clear? Done deal. B2. Draw the well-labeled diagram of the human heart. Draw the well-labeled diagram of the human heart. Marks allocated 15%. At this particular time, remember the techniques when it comes to drawing the diagram in an exam. Clear? What are the techniques? Draw the diagram using the pencil. The arrows should be in pencil. The labels should be in pen. No crossing the arrows. Don't forget the title of the diagram. Lastly, put the diagram in a box. And that box you should draw using the pencil by using the ruler. Those are drawing technique. Clear? Remember that in an exam, because diagrams are part of your component in an exam, and the hour to start perfecting is now not in an exam. So start perfecting in your drawing technique. After this lecture, make sure you visit the human heart, then you can draw so that you can perfect. Well done and dusted. Clear? Don't you see? Identify 5 problems and write a nursing care plan for Natasha. Marks allocated 50%. As usual, nursing care plan are part of your component in an exam. Clear? Nursing care plan are part of your component in an exam. This exam you are writing, you will be meeting a lot of nursing care plan. And the hour to start perfecting is now not in an exam. Clear? Make sure you know how to write the proper nursing care plan. Ladies and gentlemen, know how to write the proper nursing care plan. This exam you are writing, you are going to meet nursing care plans. Be sharp. Clear? Done deal. Number 1 problem, ineffective tissue perfusion. Ineffective tissue perfusion related to reduced hemoglobin concentration. Related to reduced hemoglobin concentration. Evidenced by para. Evidenced by para. Number 2 problem, imbalanced nutrition less than the body requirement. Imbalanced nutrition less than the body requirement. Related to insufficient iron. Related to insufficient iron. Evidenced by weight loss. Evidenced by weight loss. Done deal. Knowledge deficit. Knowledge deficit, another problem, related to lack of information about anemia management. Related to lack of information about anemia management. Evidenced by patient asking questions about medication. Evidenced by patient asking questions about medication. Next, disturbed sleeping pattern. Disturbed sleeping pattern related to weakness. Evidenced by insomnia. Evidenced by insomnia. Next, acute pain. Acute pain related to tissue hypoxia. Related to tissue hypoxia. Evidenced by headache. Evidenced by headache. Clear? So these are some of the common problems you can bring in an exam. So students, we keep on mentoring you. After this lecture, my friend, make sure on each problem you write the goal, you write the proper interventions Remember, you need to write 4 interventions, each intervention with the supportive rationale. Clear? Then you evaluate. That's how we perfect on nursing care plan. Be sharp. Clear? Let's finish off with part D, which is saying explain 5 complications of anemia. Explain 5 complications of anemia. At this particular time, you know how to explain complications. Clear? Remember the techniques. Number 1, heart failure. Number 1, heart failure. Then you are going to start like this. This is how you should be explaining complications. Clear? You are going to say, when Natasha has anemia, and if it is left untreated, when Natasha has anemia, and if it is left untreated. Clear? So the heart is forced to pump blood faster. The heart is forced to pump blood faster in order to supply enough oxygen to the body tissues and also different organs and muscles. Clear? And this extra workload weakens the heart muscles, resulting into heart failure. Resulting into heart failure. Done. Deal. Number 2, angina pectoris. Number 2, angina pectoris. Clear? When Natasha has anemia, and if it is left untreated, that causes reduced oxygen delivery to the heart muscles, causing chest pain, resulting into angina pectoris. Done. Deal. Number 3, cardiac arrhythmias. Cardiac arrhythmias. Clear? When Natasha has anemia, and if it is left untreated, clear? And if it is left untreated, the heart beats faster. Clear? And that causes irregular heartbeat as a result of what? Poor oxygen supply. Clear? Resulting into cardiac arrhythmias. Resulting into cardiac arrhythmias. Done. Deal. Clear? Next, multiple organ damage. Multiple organ damage. Below, you're going to say, when Natasha has anemia, and if it is left untreated, that causes less oxygen reaching the brain. That causes less oxygen reaching the brain, the kidneys, and also the liver. And this leads to damage organ tissues and affect their normal functioning, resulting into multiple organ damage. Resulting into multiple organ damage. Clear? Done. Deal. Another complication, shock. This one you can try. You see if you are following the techniques. Clear? This is how you should be explaining in an exam. Until we meet again, it's bye-bye for now. So make sure those who are writing NMCZ, keep revising. The hour to revise is now. Start perfecting in your drawing technique, nursing care plans. Know the techniques when you are explaining complications, when you are explaining the IEC, preventive measures, indications. The rest just do wafo, deal, done. Until we meet again, it's bye-bye for now.